Uh, Hello guys, myself R.D. Prashil. I teach everything related to psychology at skyrocket.com. Please visit the website. Today we are going to learn about clinical psychology. This is a very brief crash course of clinical psychology. We are not going to go in detail. Now these are the only units we are going to study. A small introduction, then we are going to study about mood disorders, then the disorders of anxiety, trauma and stress, then dissociative disorders, eating disorders and personality disorders. So coming to unit 1, there is a little bit confusion regarding clinical psychology, abnormal psychology and psychopathology. Many people use these words interchangeably, but there is a difference between all the three. Okay, see, in, in a way, psychopathology is the broader term. It is these three definitions are given by the American Psychological Association APA. These three definitions are available in the APA dictionary itself. So what is psychopathology? It is a very broad scientific study of mental disorders, including their theoretical underpinnings. Like they study about why certain what are the root causes of certain disorders. They will explore those disorders in from different perspectives like biological, psychosocial, psychodynamic and everything. We will see them also. And then there is etiology. Yes, etiology is nothing but causes, progression, how it progresses uh, over a period. Then there is symptomology, what are the symptoms of those particular disorders, then what could be diagnosis and treatment. Okay, the entire research and framing of those disorders will come under psychopathology. Not just disorders, everything that is abnormal. Then coming to abnormal psychology, that is a branch of psychology devoted to the study, assessment, treatment and prevention of maladaptive behavior. See, abnormal behavior might not be related to researching about those theoretical underpinnings, etiology and all. But what it does is, it studies about all the abnormal behavior and not just established disorders. Okay, then there is clinical psychology, which is a very specialized field that specializes in the research, assessment, diagnosis, evaluation, prevention and treatment of emotional and behavioral disorders. See, whatever the disorders are already established in DSM-5 or ICD, only those disorders the clinical psychology will treat. But then what about abnormal psychology? Anything that is other than normal, it comes under abnormal psychology. But in the clinical psychology, anything that is abnormal doesn't come into clinical psychology. Only the established disorders will come under clinical psychology. Okay, see, psychopathology is the broader term, then there is abnormal psychology, then within that there is clinical psychology. Okay, now then what is abnormality? It relates to any deviation from what is considered typical, means normal, usual or healthy, particularly if that deviation is considered harmful or maladaptive to that person or to others also. Then what is maladaptive? Anything that does not allow a person to function within or adapt to the stresses and everyday demands of life. Okay, okay, so this is maladaptive, right? Then how do you declare maladaptive? How can you say someone is maladaptive? And what is the decision point? It usually depends on the social norms. What are the norms of that society and how that person is behaving? If that person is behaving within that societal norms, then it is normal. If it is outside that, it could be abnormal. But that same abnormal behavior could be normal in some other society. Okay, then there is statistical deviance. Statistical deviance is nothing but like, if you want to explore statistics briefly, please refer to statistics crash course. See, if you see IQ, there are specified ranges, predetermined ranges, like 100 is the average, 100 to 115 is somewhat this one, and less than 70 are mentally retarded or something like that. So according to that also we declare abnormality. Then situational context, obviously it depends upon situation to situation. Then there is subjective discomfort, like the whole world might not see your abnormality, but you could be introspecting your own abnormalities, only you might understand. Then there is inability to function normally. Obviously what is abnormality? You cannot function normally. So in abnormal psychology and clinical psychology, there are certain models of abnormality based on which we define what is abnormal and how it can be treated, how it can be diagnosed and all. First thing is biological model. It is a model of explaining behavior as caused by biological changes. That's it. in the chemical, structural, or genetic systems of the body. Basically, it says that certain abnormal changes in our body arises from biological changes. Then there are psychological models in which there are three. First one is psychodynamic view, which sees abnormality as a result of repressing one's threatening thoughts, memories, and concerns in the unconscious mind. Repressing is one of the defense mechanisms. Please refer to personality crash course to understand that. Then there is behaviorism, which sees abnormality as learned responses. Okay. If they are learned responses, like learned pattern of responses, then behaviorism sees that abnormality as a personality, as an abnormality in personality itself. Then what about disorders? Behaviorism sees disorders as learned behavior. Then there is cognitive perspective, sees abnormality arising from illogical thinking patterns. What are these illogical thinking patterns? We will study them when we get to anxiety, trauma, and stress disorders. Okay. Then there is socio-cultural perspective. Abnormality is seen as the product of learning and shaping within the context of the family, social group to which one belongs, culture within which family and social group exist. See, let us say this lavender color or purple color one is the context of the family. Your own family has certain culture, right? Then there could be another, like you go to college, you go to school, there will be your friends there. The culture might be different, and sometimes these two cultures might intersect also. Then there is the entire culture, which for say, let us say Indian culture, within which both your family and the social group which you belong, like school, college, everything else exist. So all these three defines what is abnormality. Then there is one point in clinical psychology where cultural differences in abnormal thoughts or actions must be addressed while attempting to assess and treat members of a culture that is different from us. For suppose you are aiming to become a clinical psychologist, then you belong to, let us say, Indian culture. Then you are working somewhere in Delhi or Mumbai. Then an international client came to you. Before defining what is abnormal, like before saying before defining their behavior as maladaptive or abnormal, please refer to their cultural norms. Okay, only then you can decide what is abnormal and what is normal. Okay, mostly happens when um, when the professional belongs to one culture and the client belongs to another culture, like collective, you have the idea of collectivistic and individualistic cultures, right? So whenever the professional belongs to one culture and the client comes from another culture, these issues might happen. Okay. Now there is a biopsychosocial perspective, which is nothing but all the combinations of previous three. Abnormal behavior is seen as the result of combined and interacting forces of biological, psychological, and cultural influences. Okay. So then now we are going to study about disorders and all. Before that, there are just two more points, but this is most important one we should keep in mind: psychology student syndrome, which is it can be defined as psychological students studying abnormal behavior. Like when we study abnormal behavior, sometimes get convinced that we have some mental disorder, but it is not. See, to be diagnosed with a certain mental disorder, we need to meet certain criteria according to DSM or sometimes ICD also. Only when we meet at least the minimum criteria of that particular disorder, we will uh, we should be diagnosed with that disorder. Just because we have met one of those symptoms for just some of the time, it doesn't mean we have the disorder. So please keep this in mind. No. So what is a disorder? Basically, any pattern of behavior or thinking that causes people significant distress. Wait, uh, if you behaved like, if there is a behavior but which is not repetitive, you just did it on one day, you just did it for 2 days or something, it cannot be diagnosed as a disorder. To diagnose it as a disorder, it must be a pattern. Okay, which means you are repeating that same behavior from longer times, that causes people significant distress, causes them to harm others or themselves, or harms their ability to function in daily life, which is nothing but maladaptive behavior. Okay, so this is what the definition of disorder. Okay, now so to diagnose any mental disorder, there are two references for any clinical psychologist or psychiatrist or anyone. So there is this diagnostic and statistical manual for disorders, and then there is international classification of diseases. See, DSM is given by American Psychiatric Association. Please remember, not American Psychological Association. It is given by Psychiatric Association. Then it is dedicated to especially mental health disorder. Whereas ICD is given by WHO, but it has all the diseases in the world, and within which one of the section is dedicated to mental and behavioral disorders. Okay. Coming to unit 2, mood disorders. So, what are mood disorders basically? It deals with affect. Affect is nothing but feelings. In psychology, AFFECT is also referred to feelings and emotions. Okay, they are also called affective disorders. Obviously, disorders in which disturbances in emotion and also in which mood is severely disturbed. In mood regulation, these three neurotransmitters plays a vital role: serotonin, norepinephrine, dopamine. Like, if you want to know them in detail, please refer to biological psychology crash course. We are not covering them right now. Then we study just two disorders. There is major depressive disorder, then there is bipolar disorder, in which there are two variants. Okay, now what is MDD? Major depressive disorder: severe depression that comes on suddenly and seems to have no external cause. Like, that cloud, that depression will come on suddenly without any external cause. Like, see, for suppose grief is not depression. For suppose someone passed away in your own family, like it could be family member or friend, then you will feel sad for few weeks or something. That could not be considered under depression. Okay, in major depressive disorder, it and it is too severe for current circumstances, like that, right? So if something really happened, then you could feel sad and you could feel depressed for some time. But without, if it comes without any circumstances, without any external causes, and if the depression is too severe for your current situation, then it can be considered as major depressive disorder. And it is most commonly diagnosed mood disorder. It is a unipolar disorder. You will understand what is unipolar when you study bipolar actually. Then there is a variant of MDD, which is seasonal affective disorder, one of the variant with a seasonal pattern. For suppose, see, in all our lives we will go through certain phases in which we feel depression, right? For suppose, let us say you passed out of your BTech and then you went to some city for a job. Then in that year, from August to September, you felt most depressing moments, because you moved from your family in 23 years for the first time, let us say. So you are staying outside without any friends and all, so you felt depressed in August and September in 2023, let us say. Then you came home, after that everything is sorted out. But again in 2024, without no external reason, when we come to August and September, you might feel that same depression without any external cause, which is nothing but called seasonal affective disorder. And in Western countries, it mostly happens due to body's reaction to low levels of light present in the winter months. Yeah, not only during winter months, even in summers, even in rainy seasons, when there is not much light outside. Okay, there is a physiological connection between like body and mind also. Like, so there, when there is much light, your body releases certain new chemicals and hormones which will make you happy and all. So without such light, you will feel a bit sad and all. Okay, yeah, same time of the year is nothing but, just I have explained, right? You went to some other city. Then there is bipolar disorder. What is bipolar disorder? Periods of mood that may range from normal to manic with or without episodes of depression. Like, this definition is for bipolar one. I'll explain, right? Periods of normal mood combined with episodes of major depression. Episodes of major depression here is mandatory in bipolar 2, and episodes of hypomania. I will also explain what is manic episode and what is the hypomanic episode. See, in bipolar 1, you will stay normal for some time, and then suddenly you will get manic episodes. But the condition to get diagnosed with bipolar 1 is, there might be depression episodes, there might not be depression episodes. Then there is bipolar 2, in which sometimes you stay normal and suddenly you go to minus negative end, which is major depression episodes, and suddenly you will go to the extra end, positive end, hypomanic episodes. So what is the difference between manic and hypomanic? Manic episodes is having the quality of excessive excitement, energy, and elevated states or irritability, means all of these comes under manic episodes. Then what is hypomanic episode? same as a manic episode, but not as severe as manic episode. A level of mood that is elevated, but at a level below or less severe than full manic episode. Okay, so in manic episode, it is very severe. Like in bipolar 1, you will get manic episodes that are very severe, and either you are normal or you are having a manic episode with or without depression, that depends. But in bipolar 2, you are normal for some time, then there are hypomanic episodes which are not as severe as manic episodes, and then sometimes major depression will also come. Only when those depression episodes are there, you can diagnose them as bipolar 2. Coming to unit 3, disorders of anxiety, trauma and stress. First, we will study anxiety disorders. What is anxiety basically? Refers to the anticipation of some future threat, often associated with worry, vigilance and muscle tension. Okay. So, this is the basic definition of anxiety, and it is different but typically related, like usually related to the emotion of fear and the physiological consequences of sympathetic activation. Again, we are not covering sympathetic activation here. Please refer to biological psychology crash course. Okay. See, anxiety is related to the emotion of fear, but it is not entirely the same. Anxiety disorders are a category of disorders in which the primary symptom is excessive or unrealistic anxiety, and there is a term called free floating anxiety which seems to be unrelated, like when that anxiety is unrelated, is not related to any realistic and specific known factor, it is called as free floating anxiety. For suppose there is an exam coming up, it is normal to feel anxious, and there is an exam result coming up, like for suppose many of you have written UGC-NET, right, and you might have been waiting for the result, so you might feel normally anxious, those are normal. But if that anxiety comes without any particular reason, then that can be called as free floating anxiety. Now coming to disorders, the first one is generalized anxiety disorder. What is that? Excessive anxiety and worries. See, what is the basic symptom of anxiety disorders? Primary symptom is excessive or unrealistic anxiety. Same, excessive anxiety and worries occur more days than not for at least 6 months, which means you will feel excessive anxiety and worries at least more than 50% of these 6 months. So there is a tendency in this GAD, there is a tendency to worry about situations, people or objects that are not actually problems. Okay, I have already told you, right? For suppose if someone is really threatening you, if someone has you got a suspicious call from someone threatening you, then it is okay to feel anxious. But without any such situations, without any such harmful people, without any such objects, if you feel the excessive anxiety, then only it can be considered as generalized anxiety disorder. Then there are the symptoms of which are tensions, there are muscle aches, sleeping problems and concentration problems. All of these are symptoms and problems of anxiety, generalized anxiety disorder. Then there are phobic disorders. Phobia is nothing but an irrational persistence, means a continuous fear of an object, situation or social activity. There are many phobias. For suppose there is social phobia, sometimes also known as social anxiety disorder. Fear of interacting with others or being in a social situation. There is agoraphobia. Like there are many phobias. Okay, acrophobia, I have that. Again, we cannot diagnose very simply like that, but there is aerophobia. Okay, these are phobic disorders. Now there is obsessive compulsive disorder, in which intruding, I will explain every time with an example, wait, in which intruding recurring thoughts or obsessions create anxiety first. See, the first step in obsessive compulsive disorder is a continuous thought or a continuous obsession to, you know, to do something creates anxiety first. Then that is relieved by performing a repetitive ritualistic behavior or mental act. First of all, there is a repetitive thought, then that creates anxiety. Only when we perform a certain behavior, which is nothing but compulsion, then that reduces anxiety. For suppose you might have watched Mahan Baudu, right? So in which the hero has a obsessive compulsive disorder. What is that obsession? Hygiene, to be clean all the time. Okay, that is nothing but called repetitive thought. To be hygiene, to be clean every time. which creates anxiety. Okay, so when that obsession of I should be hygiene, I should be clean all the time creates anxiety, he performs a ritualistic behavior which is nothing but washing hands or cleaning the environment and all. Only when that behavior is performed, the anxiety gets reduced. So this is the criteria for obsessive compulsive disorder. Okay, see, there is a difference between obsessive compulsive disorder and general obsession. You say that, right? He is obsessed with cinema, he always works related to filmmaking and all, he is obsessed with his studies, he is obsessed with cricket. The difference is whether a person likes to perform that ritual but doesn't have to, or whether that person feels compelled, which means he feels mandatory to perform that ritual and feels extreme anxiety if unable to do so. For suppose you are obsessed with filmmaking, you would not feel anxiety for suppose if you had to attend a certain function, family function, then obviously you don't get to do your filmmaking or studies, you don't get to play cricket on that day, but you don't feel anxious. So when you don't feel that anxiety, when you cannot perform your ritualistic behavior just because you like it, it doesn't come under obsessive compulsive disorder. But only when you feel anxiety if you are unable to do that behavior, then it is considered as obsessive compulsive disorder. What is the main feature of OCD is the distress caused by a failure or inability to successfully complete that compulsion. Okay, just like I explained. Then there are stress disorders. See, in stress disorders, we read about two, ASD and PTSD. These both are related to exposure to significant and traumatic stressors. We will learn both of them. First one is acute stress disorder. Okay, what is acute stress disorder? It is resulting from exposure to any major stressor like war, accident, etc. See, there are certain movies in which PTSD is clearly shown. For suppose, there is a series called Bodyguard on Netflix, in which this soldier goes to Afghanistan for a war, and after that in that war he loses some of his friends. So he is exposed to a severe stressor like war, sometimes accidents also. There are many stressors like tsunami or drought. These all can be considered as major stressors. So generally it follows with symptoms of anxiety, nightmares and sleep disturbances. There will be problems in concentration. Basically what people with ASD does is they relive those events in dreams and flashbacks for 1 month following the event. Okay, this 1 month is important because that is what the defining feature of ASD and PTSD will know. Okay, so basically what that does is that situation, whatever that major stressor incident like war or accident or tsunami or flood, anything that is already happened, but the people with ASD relive those moments constantly in their minds, in their dreams, in their nightmares and all. So that is what ASD. And when these ASD symptoms last for more than 1 month, that disorder is then called post-traumatic stress disorder. Okay, that's what the lead role in Bodyguard has. The symptoms for ASD, like for these stress disorders, symptoms may occur immediately or it may not occur until 6 months or later after the traumatic event. Okay, treatment for both ASD and PTSD is psychotherapy and use of drugs to control anxiety. Okay, so there is one of the crash course dedicated to only therapies. Please refer to it to understand what is psychotherapy. So okay, we are done with anxiety, trauma and stress disorders. What are those umbrella reasons for these disorders? We'll know. First, the psychodynamic model explains anxiety as a danger signal that represent urges or conflicts are threatening to surface. Okay, then there is behavioral model which explains anxious behavioral reactions are learned. Behavioral model always explains everything is learned. Okay, then there is cognitive model. We have already seen that cognitive model basically sees any disorder as an illogical, irrational thought process. Like it sees them as a result of these processes. Then what are these processes actually? First one is there is magnification. The tendency to interpret situations as far more dangerous than they really are. Like for suppose, dangerous. There is a situation, let us say you have an exam, but having an exam is not an extremely dangerous thing, but you will magnify it to be more dangerous than it actually is. That is first thing. Then there is all or nothing thinking, the tendency to believe that one's performance must be perfect or else the entire result is a total failure. So if you believe like that, there are there will be certain people who thinks that whatever I do should be perfect, other than what they think is if they fail to meet that perfection, then they think that it is completely a failure. Then there is overgeneralization, in which a person draws conclusion without facts based on only one incident. Like, see, overgeneration is nothing but they judge people only on one incident, or they might draw, they might infer, they might frame certain stereotypes, they might frame certain opinions on just one incident, and then they apply those events that are unrelated to the original. Whatever that person draws conclusions from that one incident, he applies to uh, every event that is actually unrelated to the original event. This is also one of the illogical thinking pattern. Then there is minimization, tendency to give little or no importance to one's success or positive events and traits. They think that everything about them is negative. They think that even though they succeed, they don't give much importance to their own success. So this is nothing but called minimization. So these are all coming to cognitive model. Now coming to unit 4, dissociative disorders. What are dissociative disorders? In which there is a break in conscious awareness, memory, sense of identity, or some combination in both. Okay, there is dissociation. That dissociation is involuntary in these disorders. First one, there is dissociative amnesia. Individual cannot remember personal information such as one's own name or specific personal events. Okay, see, this might sound similar to retrograde amnesia. Actually, the definition is almost the same, but when the causes are psychological, that is called as dissociative amnesia. Okay, there could be many psychological causes like repression, it could be suppression or something like that. So that will, if that leads to forgetting of personal information, then it is dissociative amnesia. Whereas retrograde amnesia has physical causes like accidents, surgeries, etc. So whenever something wrong happens during brain surgeries, or if you undergo through accident, you might lose that ability to remember personal information, which is considered as retrograde amnesia. But whereas when the causes are psychological, it comes under dissociative amnesia. Then there is dissociative fugue, when a person suddenly travels away from home and afterward cannot remember the trip and personal information. See, in dissociative fugue also you cannot remember personal information, name and specific personal events. But in dissociative amnesia, there is no such traveling away from home and being not able to remember the trip. In dissociative fugue, you will suddenly travel away from home and afterward you cannot remember the trip. Then there is dissociative identity disorder. We all have seen the Apachitra movie, right, in which there are 3 characters in single person. It is formerly known as multiple personality disorder. It occurs when a person seems to have 2 or more different distinct personalities within one person. Usually this one person has a core personality. In this example, who is the core personality? Ramu, right? And this Remo and and these 2 other characters are multiple personalities who are living inside of Ramu. So the people with dissociative identity disorders usually have one core personality like Ramu, and they have 2 or more different personalities within one person. Then there is a depersonalization or derealization disorder, in which people feel detached and disconnected from themselves, their bodies and their surroundings. If they feel detached, like they feel like observing themselves, observing their body from outside of their body. Okay, so if they feel disconnected from themselves, if they feel detached from their bodies, then it is called depersonalization disorder. And at the same time, if they feel they are detached from their surroundings, from the environment, then it is called derealization. But there are no multiple personalities here. Coming to unit 5, eating disorders. The first condition in first disorder in eating disorders is anorexia nervosa, a condition in which person reduces eating to the point that their body weight is significantly less than minimally expected. So there is body mass index and all, right? So whatever the weight is expected of your age and height, if you reduce eating to the point weight is significantly less than what is the minimum for your age and height, then that is called as anorexia nervosa. When you do that voluntarily, okay. Then there is bulimia nervosa, in which a person develops a cycle, okay. Please note that it is a cycle of overeating. First, the person will eat enormous amounts of food, like huge amounts of food in one sitting itself, and then they use unhealthy methods to avoid weight gain, like trying to vomit voluntarily, okay. So they use these unhealthy methods to avoid that weight gain. First they will eat huge amounts of food, then they will use unhealthy methods to avoid weight gain. Often people with this disorder maintain normal weight, but whereas in anorexia nervosa they fall below the normal weight. Binge eating may be prompted, like why they overeat. This may be prompted by anxious, depressed mood, social stressors, feeling about body image, intense hunger after attempt to diet, etc. Because since it is a cycle, right, so they might feel intense hunger after attempt, like after using those unhealthy methods to avoid weight gain. It is not as dangerous as anorexia, because usually people with this disorder maintain normal weight. Then there is a binge eating disorder, in which a person overeats enormous amounts of food at one sitting. But see, in bulimia nervosa also that person eats enormous amounts of food. But here the individual does not try to use unhealthy methods to avoid weight gain. He just eats. That's it, right? Understood, right? See, in anorexia nervosa, the person doesn't eat. In binge eating disorder, the person eats more amount than what is required. Then there is bulimia nervosa, in which the person eats huge amounts of food first and then use unhealthy methods to avoid the weight gain. Coming to personality disorders, the last unit. So, what is personality disorders? It is different from all the other psychological disorders. How? In personality disorders, the entire personality itself is a disorder, not just one aspect of it. For suppose you, if a person has a binge eating disorder, then, but that same person might not have any other phobias, but that same person might be, he might interact socially with everyone. So the personality itself is not the problem. Only that binge eating is disorder is the problem. But here, that the person's entire personality is the problem, which comes under personality disorder. The definition is in which a person adopts a persistence, continuous, rigid, which are not flexible, like which are rigid, matlab resistant to change, and a maladaptive pattern. We have already seen what is maladaptive pattern of behavior that influences with normal social interactions. So okay. So according to DSM-5, there are 10 primary types of personality disorder. See here, 3, 4 and 3. These disorders are categorized into 3 clusters, okay. The first cluster is A. So whatever the disorders in this cluster, so the people with these disorders are seen as just odd. They're just seen as different by others, okay. Then there are these 4 disorders in which the people are seen as dramatic, emotional or erratic. Erratic means you cannot expect what a person does next, okay. You usually within a social group you can expect what that person how a particular person responds to a particular situation. But when that person is called as erratic, you cannot expect what he or she does to a particular situation. Then there is cluster C, in which the main emotion is anxiety or fearfulness. So we will just briefly know what all of these disorders are. So in cluster A, there is paranoid, which is so the people with paranoid disorder are usually characterized by distrust and suspicion of others. They are unable to trust anyone. They are always suspicious about people. Then there is schizoid disorder, in which emotional detachment from almost everything and lack of interest in almost every social activities, okay. See, this might seem as depression, okay, but depression is one of the aspect of a personality. But when that and depression has certain stages, right? But in schizoid, the personality itself is emotionally detached with almost everything, and there is lack of interest in all the social activities. Then there is schizotypal, in which the person is characterized by unusual beliefs and eccentric behaviors, like so the person cannot think rationally what is right, what is wrong and all. He believes unusual things. Then there is cluster B, in which antisocial, disregard for the rights of others, and often also violating the rights of others, like He doesn't care about others. Yeah, in a way, the person with antisocial personality disorder doesn't care about others. Then there is borderline personality disorder, in which it is characterized by instability in almost relationships, self-image, emotions, and it is also that personality disorder is also characterized by impulsivity, which means that person does everything on a whim. Okay. Then there is histrionic disorder. It is marked by excessive emotionality and attention-seeking behavior. They feel very emotional even for small things. Then there is narcissistic disorder, in which uh, they prioritize their own self more, like huge sense of self-importance, and there is a they constantly feel those need for admiration from someone else outside. Then there is lack of empathy. They don't feel empathetic towards anyone. In cluster C, we have three: avoidant personality disorder, feelings of inadequacy, which means sometimes the people with avoidant personality disorders often has low self-worth, so social inhibition, like they don't mingle with people socially. Then there is hypersensitivity to negative evaluation, like even if someone criticized them even very little, they feel hypersensitive to that. Then there is dependent personality disorder, which sounds like an opposite of avoidant personality disorder, which involves excessive need to be taken care of, leading to submissive and clinging behavior. Like, see, dependent personality in the people with the dependent personality disorders, they feel that they cannot take care of themselves, and they always feel that urge to someone else to take care of them. Then there is obsessive compulsive. See, this is different from the obsessive compulsive disorder. This is obsessive compulsive personality disorder, which is marked by preoccupation with orderliness, like everything should be clean, everything should be neat. Yeah, but in obsessive compulsive disorder, we will focus there is a focus on only one ritualistic behavior. For suppose in Mahanbadu it is cleaning, right? But in obsessive compulsive disorder, almost everything should be in order, everything should be perfect, and everything should be under control to obsessive compulsive personality disorders, and that is how it is different from OCD. So thank you so much for staying until the end, guys. So with this we conclude clinical psychology. This is just a brief overview of clinical psychology, and if we go into depth, there is much more to read. There is DSM-5. We need to have a good idea of what is in there to diagnose a particular person with a particular disorder. So there are some other courses as well. I've done several courses on my channel and on skyrocket.com website also. Feel free to visit my website and channel, and if you really felt that this video is valuable to you, please share to your friends, and please subscribe to get more videos like this.